Welcome to the AFM's video presentation on the amendments to the Personal Health Information Act, PHIA, and the Mental Health Act, disclosure to lessen or prevent risk of serious harm. In this training, we will cover the details of the amendments to both acts and the policy AFM will follow. We will also go over scenarios to illustrate decision-making around disclosure under the new amendments. This presentation and supporting policy focuses primarily on the disclosure of personal health information to natural supports. But it is important to note the amendment permits disclosure to other third parties, for example, the police, in the event that there are no other supports or contacts available to assist the individual. Requests from other agencies, which do not fall under the disclosure due to risk of serious harm, are processed under existing policies, such as our Disclosure of Personal Health Information policy. These are the AFM policies directly relevant to this discussion. Other policies are also relevant, those in the area of client file documentation, Protecting Children's Information Sharing Act policy, discharge and early discharge, client communication, risk assessment, and others. We are now going to define some important terms. Risk is defined to include risk to life, limb, or function. Serious harm is based on clinical judgment. Disclosure refers to the release of personal health information to any person based on a clinical determination. Whenever personal health information is released, it must be the minimum amount necessary to accomplish the purpose. The policy uses the term natural support. AFM uses the term family, which is the family defined by the client. An extensive stakeholder engagement process involving clients, families, and care professionals provided the guiding principles which have been adopted as part of the provincial policy. Consent. A client's consent to disclose personal health information remains best practice. Any disclosure without consent must be client-centered and the rationale for the disclosure identified. Remember that disclosure is permissive and not obligatory. Just because you can doesn't mean you must. Unless there is a specific care or safety-related reason not to, attempts must be made to contact the individual prior to disclosure without consent. Right to know. The client has a right to know if a disclosure of their personal health information has been made without their consent. Every effort shall be made to advise the individual about the information shared, to whom and why. Needs and best interests. The decisions to disclose personal health information is clearly determined based on the client's needs and best interests. Rights, dignity, and autonomy. Determination of risk must not remove a client's basic rights and dignity to determine their own lifestyle choices and acceptable personal risks. Self-determination and personal autonomy are integral principles of personal recovery. Contacts and natural supports. Helpers shall continue to have discussions with clients to build natural supports and preferred contacts into the client's profile at every episode of care. Steps must be taken to ensure the contact information of the client is current so they may be contacted for consent. Clients should be reminded of their option to have more than one contact person on record and specific circumstances where these contacts are to be contacted. Consider a hierarchy of who may need to know information to a lesser risk, as opposed to who wants the information. Accountability. Helpers need to consider accountability to the person to whom the personal health information was disclosed. The person disclosed to may reasonably experience impacts of their own based on the information of risk to the client. Helpers must carefully balance their authority to disclose personal health information against other factors such as potential risks to the person receiving the information. The helper must ensure the information is meaningful to the person receiving it. Collaboration and consultation. When the risk is not immediate, the determination to disclose personal health information without consent in order to lessen the risk of serious harm should be reviewed by the staff person's supervisor. Consultation is an expectation for staff in the provision of client-centered care. Minimum. PHIA requires helpers to limit the personal health information disclosed to the minimum amount necessary to accomplish the purpose for which it was used or disclosed. Once the risk has passed, the disclosure of further personal health information without consent is no longer authorized. These legislative changes affect staff working directly or indirectly with the public, who may encounter situations where they have concerns about people's well-being or safety. Therefore, all staff must be aware of the legislation and their responsibilities. Although not all staff members are providing direct client care, they are expected to notify their supervisor or director if they encounter situations when they feel someone is at risk of serious harm. Consent. Collaboration with the client and consent to involve family and other supports in care planning is always the best practice and may limit the times we may need to disclose personal health information without consent. The hope is that when disclosure is in the individual's best interest, that it is done with consent, and that the cases without consent should be infrequent. Consult. If after completing a risk assessment you suspect a risk of serious harm and feel it is necessary to disclose personal health information and consent is not provided by the client, consultation with your supervisor is required to help make the right decision. As part of normal practice, documentation is required to ensure there is a record of your assessment and decisions, including the decision to disclose or not to disclose personal health information. Good documentation is always important for a decision that you have made, especially when a decision is difficult. Please consult the Personal Health Information Disclosure Due to Risk of Serious Harm policy. Documentation must include the following: assessment and identification of risk of serious harm, the rationale for disclosure, discussions with the client, family, and supports, and if not, why, agreement or not pertaining to consent of disclosure, whom the personal health information was disclosed to, and what was disclosed, the plan to mitigate the risk and who is involved, and any additional interventions or follow-up. We will cover each of these questions in turn. How will you know if a risk of serious harm exists? AFM is introducing a risk assessment form to be used in cases when a client is discharging early or we feel they may be at risk. This form is covered in a separate training video. Do I have to disclose? Helpers are not required or obligated to make a disclosure they are not confident is necessary to lessen a risk of serious harm. To help you make this determination, a risk assessment tool and a decision-making algorithm have been developed that you can review to help you make that decision. Also remember that the person receiving the personal health information should be someone with the capacity and understanding to take action to lessen the risk of harm to the individual or another person. How will I know what to disclose and to whom? Helpers are increasingly aware of the importance of natural supports in good client outcomes. It is reasonable to think that a known natural support may be a good person to contact and share information with to lessen a risk of serious harm. The new provision allows the engagement of the natural supports more permissively than in the past. Here is a scenario. A 30-year-old female is brought into the emergency department by police, who report they were contacted by a concerned friend who reported her as being suicidal. The assessment finds that she is unhappy about being in the emergency department, but assures that she is okay. She appears to be competent and future-oriented. The clinician determination is that she requires further assessment, but she states she is tired and just wants to go home. She refuses an offer of a cab and says there is no one she wants to call to pick her up. The friend is listed as an emergency contact. Can her friend be called to be advised that she is discharged against medical advice? The answer is yes. If the health professional reasonably believes that there is a probable risk of serious harm to the patient that could be lessened by advising the friend that she has opted to leave against medical advice, The friend can be informed. Here are the considerations to be made before disclosure. Is the risk probable? If it is, why? Document your reason. Has collaboration with your supervisor occurred? If yes, what information will a natural support need to know to lessen the risk? Consider including contacts for other supports or agencies. Remember to document in the client's file. Here's another scenario. A counselor has met with John, a 34-year-old, for the past 3 months. There is a history of depression and substance use issues. John was referred after a suicide attempt. John is generally doing well but continues to struggle with suicidal ideation. John leaves a session unable to contract for safety. The counselor tries calling John's cell phone later in the day to check in, but it goes directly to voicemail, which is full. John lives at home with his parents. By his account, they are not close, and he feels his mother judges him harshly for his mental health struggles. The mother is not aware he has sought counseling services. There are no other known supports. The counselor calls the home phone, and the mother answers and asks if the counselor is a friend, as she is concerned. Can the counselor identify themselves and explain why they are calling? The answer is yes, if you have answered yes to the following questions. Does the counselor, after a clinical assessment, believe there is a risk of serious harm? If yes, has collaboration with the supervisor occurred? If yes, is there a reasonable basis to think that the disclosure may lessen the risk, and what is the risk of disclosing versus not disclosing? If the decision is to disclose, what is the minimum amount of information that the person may need to know to lessen the risk? Always be prepared when you make a call to disclose, such as, how will you identify yourself? Have the information that you plan to disclose already determined. Be clear, concise, and supportive of the family or natural support individual. Remember to include contact information for other support programs and agencies for the natural support person. Document the reasons for your decisions. A 40-year-old person, Joanne, presents to the emergency department requesting care due to injuries sustained in a fall. Clinical assessment reveals a right fractured arm, bruising to the right rib area, and 2 black eyes. She has difficulty making eye contact and is fidgety, and is concerned about how long it will take to receive care, stating that she needs to get home as soon as possible. Past history includes a previous visit with multiple contusions across the torso and lower back, also attributed to a fall. She lives with her husband and 2 teenage children, and her sister is listed as a second contact. As a trustee or a health professional, you suspect domestic abuse, and discharging her back to the same environment poses a probable risk of serious harm. You discuss your suspicions with Joanne, but she denies these allegations. You have discussed possible supports and resources available and request a consent from Joanne to reach out to these supports on their behalf. Joanne refuses. Can you contact her sister to discuss your concerns? The answer is yes. The legislation permits disclosure to the extent necessary to anyone the trustee or health professional reasonably believes may lessen the risk of serious harm. These are things to consider with this scenario. Consent is not being provided, therefore disclosure must be done without consent. Did a consultation with the supervisor occur? Is there a reasonable basis to believe there is a risk of serious harm and that calling the sister would lessen that risk? If you feel there is a chance that the risk may increase by contacting the sister, then this may not be the best option. Should considerations be made to contact the police instead? Remember to document your decisions. Let's consider. An adult individual with schizophrenia has disclosed to you that they have stopped taking their medication, something that is being hidden from their family with whom they reside. You know from their history that they can get very sick after a time of not taking this medication. The parents have been successful in the past at convincing them to get back on this medication. Can you disclose to the family that the individual has stopped taking medication, even though the individual has expressly asked you not to do so? The answer is yes. Inform the individual of the intent to disclose, as the individual still has a right to know that the disclosure was made, unless there is a reason that this information should not be shared. These are things to consider with this scenario. Have you consulted with another health professional? Is disclosure in the best interest and needs of the client? Will disclosure lessen a risk of serious harm? Can the family support the individual and take steps to lessen the risk of serious harm? Will the client's dignity and autonomy be carefully considered in the decision to disclose? If the answer to the above questions is yes, then you can disclose information to the individual's family. Remember to document your decision. Manitoba Health Seniors and Active Living has rolled out a set of mandatory activities and expectations around the new Personal Health Information Act provisions. These include: all health services organizations must train all of their mental health and emergency department staff in the changes to legislation and concurrent Manitoba Health Seniors and Active Living requirements, including 1. Completion of assessment and identification of risk of serious harm. 2. Engagement of individual and their identified natural supports to inform care plans and risk assessments. 3. Mandatory formal documentation of the above and any disclosures made to lessen risk of serious harm. Compliance with these requirements will be subject to audit by Manitoba Health Seniors and Active Living. These resources are available to you for assistance in decision-making around the changes to PHIA. The decision algorithm is a flowchart to help you think through situations you may be presented with. It is included as a document in this Moodle training. PHIA and the Mental Health Act can be accessed online, and AFM policies are available to all staff on the bulletin board. AFM's privacy officers and your supervisor can provide consultation when issues and questions arise. This concludes AFM's video presentations on the amendments to the Personal Health Information Act, PHIA, and the Mental Health Act, disclosure to lessen or prevent a risk of serious harm. You will find a quiz located on the Moodle homepage for this training. You must complete this quiz in order for AFM to track that you have completed this training.